Is it safe to take hormone therapies? It is safe to take hormone therapies if you're under the guidance of an experienced doctor who knows what he's doing. We should actually change the question and say actually that it's unsafe not to take hormone therapies after age 30, 35 or 40 years. Why? Why? Because our hormone secretions decrease with age. And what is a hormone? Hormone is a sort of substance that is made in a tissue and that goes in the blood and goes to many organs where it's going to stimulate the function of the organs. So if you don't have enough hormones, you are a sort of organ deficiencies all over. Your body doesn't function well. You can get fatigue, you can get depression, you can feel pain, you can also look less good and have maybe more fat accumulation, for example. So it's very important to treat our hormone deficiencies. And so with age, from age 30 on average, in most people, all the hormones secretions begin to decrease in our bodies. Some quicker, some slower. Among the quickest are DHEA and growth hormone therapy. But also sex hormones decline quite soon, and there's a little bit slower thyroid decline, but thyroid is often disturbed already long before anyway. So it is important to be able to know this and also to do something about it. Because what happens if you don't take hormone therapy? Well, then you just age like everybody else. Do you really want to age like everybody else? Do you really want to feel the pain in your muscles and in your joints at age 50 or 60 or 65, the back pain? Do you really want that your body becomes aged, older looking? Do you really want to have this fat accumulation in your body and decrease in muscles? Because that all happens when you have a lack of hormones. In a cell, for certain hormones, each cell gets for certain hormones thousands of molecules of that hormone each day. For growth hormone, maybe just 250 each cell of our body receives. 250 molecules of growth hormone is still quite a lot, but some that's 10,000 or 1 million of those molecules that come in our body, and they all decline. So if you have a 25% decline, you often have billions of molecules in your body who are missing. Do you really want this? Well, it's simple. Is to find a doctor who is able to help you balance your hormones back and to correct the hormone deficiency by giving supplements. So it's really important. There's many studies showing that hormones like thyroid, testosterone, female hormones, growth hormone, and are protective against cardiovascular diseases, against aging of the arteries, atherosclerosis, against hypertension, or in some cases hypotension, arterial hypertension. So obesity, diabetes, cancer, osteoporosis, even cancer, some hormones have protective effect, like often thyroid hormones seem to have in many studies, progesterone in studies for breast cancer, the real progesterone, not the synthetic derivative that has adverse effects there. Even in growth hormone, some therapy in adults, studies have shown 50% decline of the increased cancer incidence that these people with growth hormone deficiency have. But it has to be personalized treatment, otherwise it's unsafe. So if the doses are not adjusted to what your body needs, then you get overdosage, and that's not interesting too. So as a patient, you should try to get information. You should try to know what happens, what are the complaints you have, what are physical signs you have when you have this hormone deficiencies, and what are the excesses. If you get a treatment, you have to be able to screen, to recognize the excesses and then decrease the doses. And that will make treatments much safer also if you participate as a full team member in the making up of your program with the doctor who has experience in doing it. Basically, my advice is hormone therapies are safe. You should take them, but you should find a doctor who can control the treatment, do the necessary lab tests, do the necessary physical examination on you, and help you understand how you can also see if the treatment is sufficient or insufficient or excessive, so that you really get this personalized treatment that you deserve to have.